what is the efficacy of these drugs? As I said that the whole scenario of the medical management was changed ever since the PG analog was introduced in 1996. The latanoprost was the first drug which was introduced in 1996. Subsequently, the travoprost and the bimetroprost was also introduced. Obviously, we would be discussing in between the uniprostan came, or even before latanoprost, uniprostan came, but it was only confined to Japanese market, and it was not as efficient or as potent. So why the PG analog has changed the spectrum of the medical management of the glaucoma is because you see the efficacy of these drugs. Tremendous, enormous. It reduces the intraocular pressure by almost 30 to 35% from the baseline. It is enormous amount of reduction. And the dosing is just once a day. And after that was the most popular is the beta blocker, which reduces the intraocular pressure by around 20 to 25%. And the brimonidine, obviously it is maybe equal to or maybe a little less potent than the beta blocker, and it reduces the intraocular pressure. It was reported over here, but you see that at trough, it is not as potent as the beta blocker. So the brimonidine comes after that, and then is the topical carbonic anhydrase inhibitors. Okay, so that is how the efficacy of these drugs go down. And now, as I said earlier, that the beta blocker remains the gold standard, and all the drugs still are compared with the beta blocker. And initially, they used to compare with the beta blocker, and now the US FDA has let down the criteria of the non-inferiority to the beta blocker, and then only they approve the drug in the US market, and the US FDA approval gets. So that is why the nitarsudil got the US FDA approval, because it was non-inferior to beta blocker, means it was superior to beta blocker. So that is one of the important criteria laid down by the US FDA, that the non-inferiority, and that's why we are seeing that not so many drugs are rolling out these days. But the Rho kinase inhibitor, the nitarsudil, reduces the intraocular pressure by approximately 25 to 27% from the baseline, and that's why, because being a non-inferior to the beta blocker, it got approval from the US